Now, Philippine health tech startup Nova Health recently announced the acquisition of the local operations of Madrid-based Insurtech firm Asistensi. Now, aside from this, Nova Health aims to extend its services to other firms in the country in its bid to tech up the entire healthcare ecosystem. So for our first guest this morning, we have Nova Health co-founder and CEO Bjorn Pardo. Bjorn, welcome to Market Edge.
Thank you for having me. It's great to be here.
Yeah, it's good to have you here. All right. First off, congratulations on Nova Health's acquisition of the Philippine business of Asistensi, global insurtech firm. Now, tell us what this means for Nova and Asistensi.
Yes, first of all, thank you very much, and we are very excited to expand our services into the entire Philippine market, right? And so, what this means for Nova Health and Asistensi is, we want to, as Nova Health, kind of focusing fully and solely on the Philippines. We not only want to give Filipinos access to quality healthcare, or more Filipinos to quality healthcare. We want to encourage all the other healthcare companies in general, to join us in this mission that we have to create a more sustainable and prosperous Philippines. And we have technology that we acquired from Asistensi that allows us to really accelerate this mission of ours.
All right, Bjorn, what prospects do you see in the Philippines in terms of insure technology? I mean, what is the market landscape like in these parts, and is it growing as fast as it should? All right, we now have back on the program Mr. Bjorn Pardo of Nova Health. As we were discussing a while ago, I wanted to ask you what prospects or business prospects do you see in the Philippines in terms of insure tech? What is the landscape like, and are we moving as fast as we should in that space?
No, that's a really great question. I think all of us may know by now that the Philippines is vastly unprotected and underprotected in terms of healthcare. And what we're trying to do is we're really trying to create a service that is much more affordable. And looking at how healthcare is delivered in the Philippines, and really trying to come up with a very unique and innovative way to make it more accessible, not just in terms of price, but in terms of how we operate, and also through technology. And we know that we cannot do this ourselves. So we're extending the technology that we have to other companies out there, whether they be a health insurance company, whether they're a non-healthcare company that can benefit from telemedicine. We want to extend this technology to the entire country to help us achieve our mission, and maybe we can do it all together.
All right. Now, Bjorn, just some concerning stats now from an article of the Independent Investor, which says Filipinos spend roughly 10,000 pesos a year for health-related goods and services. Household out-of-pocket payments also at 44.7% of all healthcare-related spending. That is in 2022, with voluntary healthcare payment schemes of just about 10.5%. Now, context, what does this tell us?
But what this tells us is that, there's a lot of unnecessary spending for healthcare on the part of individuals.
Yeah.
And that's really because they are underprotected or unprotected. So they end up having to, unnecessarily go to the ER and spend an enormous amount of money for a sickness or an illness that they could have prevented, if they had some proper quality health care. And that's where we're trying to come in, is provide an affordable health plan that can keep the entire population healthy and resolve common illnesses before they become a burden, not just to themselves, but also to the entire healthcare infrastructure system.
All right. Now, Bjorn, healthcare in the Philippines leaves much to be desired. It has been described by the World Health Organization as fragmented. Now, what does it take to make healthcare more accessible and inclusive across all income ranges? Because you see, incomes here cannot afford premium healthcare at the very least.
Yes, definitely. I agree. And I think when you look at a lot of these cases where individuals overspend, it's really because that it's because of an illness that they could have prevented early on that leads to something much more serious. And so we have plans that are starting at 350 pesos a month, which many people can afford. And that
right.
covers
Right.
these common illnesses and really keeping the population healthy.
And how far can that 300 peso a month plan get you?
Well, that 350 pesos a month gives you unlimited 24/7 telemedicine. So you can be connected to a doctor in less than 20 seconds, 95% of the time.
Yeah.
And through that telemedicine consultation, many concerns can be resolved at that level. But if not, we also have free medicine for any common illness that our telemedicine doctor determines on that telemedicine call. Included in that 350 is free medicine delivery to your home. And if ever you do need to be seen by a doctor face to face, or you need some labs, we have a limited amount of face-to-face consultations and lab tests that are also included in this plan. So with these services, we do believe that we can tackle the most urgent medical concerns and common concerns of the vast majority of the Philippine population.
All right, Bjorn, when you talk about, the slow traction in terms of adopting to health insurance and that consciousness in the Philippines, I can imagine it's not just all about costs. There are other reasons why this market remains a laggard when it comes to healthcare. Would you care to venture what these reasons are?
Yeah, I mean, I think when you look at insurance in general, usually for you to benefit from any type of insurance, usually something bad has to happen, and no one wants anything bad to happen. So a lot of times people are over optimistic about their situation, that, I don't want to spend this amount of money because I can make sure that nothing bad happens to me. So what we're trying to do a little differently is really lead with something where people can benefit from immediately. So they do feel the benefit of what they're paying for, and specifically what I'm referring to is this very 24/7 telemedicine, right? And it doesn't have to be just for consultations. It's really for any type of question you have for a doctor. You can ask them whether that's, should I take this type of medicine or that type of medicine? That's what telemedicine can do, and I think that once people experience that, they will see the benefits immediately.
All right, let's talk about Nova now. What are Nova Health's key result areas in the Philippines, and perhaps even the milestones that you expect to hit in your growth timeline as you aim to tech up the health insurance space here?
Yeah, so we know that we can't do this ourselves. We definitely know that. So, one of our key focuses for this year is to, of course, we're going to try to do as much as we can ourselves in providing unique, innovative, and affordable healthcare services. But we know that with our technology, that we can help many more people. And so we want to reach out and encourage any company, whether you're an HMO or a health insurance company, to reach out to us, and we can help digitize anyone's operations. We can decrease the utilization of unnecessary services. So that's a really big part of our goal and focus this year.
And Bjorn, what is the way forward now for sustainable health insurance? What are the global trends, perhaps, and how are providers catching up now globally?
Yeah, I mean, I think when we look at sustainable healthcare which is our focus, it's not just about the environment, but the environment is very, very, very important. But we're trying to look at and tackle all three pillars of sustainable healthcare in not just the environmental aspect, but also the economic and social aspect. But they all tie back to sustainability or environmental sustainability. If we can keep the population healthy, it'll produce less burden or have less burden on the healthcare infrastructure that we have. And same thing for economic sustainability. If we can provide services that are much more affordable, if we can help companies become more profitable and sustainable, it all helps the environment. And so this is somewhat of a, I think the entire globe is now seeing the effects of how much we can harm the environment and how much it affects us. So I think there's a huge focus on not just locally but also globally on this concept of sustainability.
All right. Lastly, now Bjorn, how do you envision the insurtech space to evolve? I mean, with AI now, is this going to affect you in a way? Is it going to help you push?
Yes, I think AI is a benefit for everyone. We utilize it very heavily in Nova Health. My wife and I, we're leading the company now. Nova, when we took over Asistensi, and we both have been utilizing AI to supercharge not just the company but ourselves. Whether that's in every function of the company, you can utilize AI from marketing to technology, to customer service, to every single function. It can supercharge the individual and the company. So I think it's the future.
All right. Bjorn Pardo, co-founder and CEO of Nova Health, expecting to hear greater things from you and Nova Health in the future. Have a great day.
Thank you.